Recognizing and preventing sun allergies. Allergies 0. No one is truly allergic to the sun, but some people are quite sensitive to different types of sun rays and may develop mild to serious reactions after spending time in the sun. There are several types of sun allergies, but polymorphous light eruption, PMLE, a condition in the skin that occurs after sun exposure, is one of the most common. Other conditions considered sun allergies are solar urticaria, hives and reddish patches that usually start 30 minutes to 2 hours after sun exposure, actinic itchy on the chemical people who have PMLE have immune cells that are triggered by sun rays, which attack their skin, and they develop a skin reaction to the sun's ultraviolet, UV. PMLE represents 70% of all sun-induced skin eruptions. It can affect both sexes and it usually starts when someone is a teen or young adult. PMLE may be an inherited condition. Being a female, having fair skin, and living in the north or other. PMLE is more common in young women who live in temperate climates. People who live in temperate climates spend all winter out of the sun, so when it becomes warmer the sun exposure is intense. People who live in warmer climates are desensitized because they have What does PMLE look like? PMLE can appear several hours or days after the first major sunlight exposure of the season, usually during spring or at the beginning of summer. The areas of the body generally affected the most are the ones that are covered during wintertime, but not in the summer. The neck, the chest. After exposure to the sun, people with PMLE usually notice reddish patches on their skin. The spots may itch, burn, or sting, but they typically don't leave a scar. In more severe cases, the patches cover most of the body and may also be associated with headaches, fevers, tiredness, and low blood pressure. If you experience these symptoms, see an urgent care provider for evaluation. If you think you have PMLE or another sun allergy, a dermatologist. PMLE lesions often get better in approximately 10 days, and it's important to avoid sun exposure until you are healed. Make that appear tolerated.